Hi there everyone. Today I'll be presenting findings from my thesis research which explored health and wellbeing outcomes of live music performance in oncology settings. For this presentation I'll be particularly focused on the topic Deeper, Stronger, Calmer, live music in oncology treatment increasing human connection to transform healing. Firstly, I'd like to acknowledge the traditional owners of the land from where I am coming to you from today, the Turrbal people. I would like to pay my respects to all First Nations people of Australia and the Torres Strait and extend that respect to all Indigenous peoples worldwide. This study focuses on the Stairwell Project, a community music program whereby musicians use many forms of engagement from solo ensemble performances to occasional spontaneous jam sessions, leading to more active forms of participation within an oncology unit. I used a qualitative multi-method research design using participant observations to gain insider perspective, semi-structured in-depth interviews with musicians and hospital staff, giving opportunity of reflections of lived experience, and researcher field notes. I used Schulz and Northridge's social and environmental determinants of health framework as a way of understanding factors that can shape health and well-being. In doing so, I position health and well-being not only as an individual, biological or psychological experience, but also an interpersonal, social, environmental and political one. I mapped my results into the SDOH framework. Though a multitude of health and wellbeing outcomes emerged in the findings, a consistent theme across participant groups was the idea that live music allowed for deeper emotions to be shown, stronger connections to form, and the transformation of the environment. The emotion and mood theme in the individual health and wellbeing level highlights how the live music performance brought a depth of emotion to the environment, impacting both personal and interpersonal connections. It was the third most mentioned theme in this level of the SDOH framework. Oncology environments house many conflicting and painful emotions. Both nurses and musicians expressed that music was powerful in mirroring the emotion of the award. Others valued how music gave participants permission to feel, suggesting this helped deal with emotions associated with illness. Staff acknowledged that sad and happy moments allowed for deeper connections and understanding between patients, staff, family and musicians. I argue that the music created a supportive environment wherein participants felt safe to acknowledge a range of emotions and associated with oncology. Many people experience social isolation as a result of illness. For patients, carers, staff and musicians, the impact of live music on their experience of social support was significant. This category received the highest number of references throughout the entire study. Some examples of enhanced social connection included nurses socialising around the live music in their tea breaks, office staff connecting by playing games like Guess That Song, patients inviting musicians into their room for a sing-along, and as an icebreaker for families in the tea room. Team collaboration was a strong theme in the data. Multiple comments referenced the skills and abilities of hospital musicians as professionals within the environment. Their professional skills and sensibility were clearly valued by healthcare professionals. As one nurse said, "The musicians watch everything and they know if anything needs to change." Participants in this study highly valued live music as a mechanism to connect with others, viewing it as a unique opportunity for social connection and support. By developing and strengthening human connections in oncology settings, music can decrease social isolation and promote supportive environments. Music impacting the soundscape was a common theme. The music was reported to minimise workplace stresses, allowing for more effective communication between staff, with people talking quieter and more politely to each other. It was reported to help nurses relax on their breaks and decreased anxiety of all participant groups. Findings suggest that changes musicians brought to the built environment altered how participants related to the space, indicating that the music had a multifaceted impact, from changes to structure and sound to emotion and mood. Such changes are potentially valuable for long-term patients who call the ward home. Oncology environments contain many individual, environmental and social stresses, from managing fears of mortality to the stressful sounds of machines. A key finding from staff insights related to the impact of live music on interpersonal communications and how musicians shared the emotional load, making it easier for them to focus. It takes the edge off, one staff member explained. It's hard to explain. Everyone talks quieter, people act calmer, people don't bite each other's heads off. It's like a chill pill. If people try and come in and be moody and stressful, the whole environment sends a message that won't wash today. Another staff member elaborated that even if it's really busy on the ward or there's some yucky stuff going on, it brings things down a notch and makes people calmer. Sounds were reported as especially stressful for patients and families who spend long periods of time on hospital wards, and the music makes things less intense and sterile. Patients' and carers' voices were limited in this study design and were an ethical consideration throughout the study. In-depth interviews with patients and families were not included for many factors. Interviews with staff and musicians provided a bird's-eye view of the phenomenon, and casual conversations during observations provided family narratives. In summary, my research suggests that live music performance in oncology settings has significant impacts on staff, carers, patients and musicians. By transforming the built environment, live music provided a depth of emotion, calmer personal and interpersonal experiences, and stronger connections and community.